Hi, my name's Oliver Stevenson, and today I'm going to be discussing a particular body composition changing strategy. That composition strategy being the use of anabolic androgenic steroids, or the more common term, anabolic steroids. So, anabolic steroids were developed in the late 1930s primarily to treat medical issues. The primary medical uses of the compounds are to treat things like delayed puberty, some sorts of impotence, and the wasting of the body caused by the HIV infection, as well as other diseases. During the 30s, scientists discovered that anabolic steroids could be used to facilitate the growth of laboratory animals. This then led to the abuse of the compounds, first by bodybuilders and weightlifters, and then by athletes within other sports. Steroid abuse has become so widespread within athletics that it can affect the outcome of sporting contests. Although now the use of anabolic steroids isn't just exclusively for the means of performance enhancing drugs, but it also has become more mainstream in the fact that individuals are using it to better their aesthetic appearance. There are also many types of anabolic steroids, which range from those that are orally ingested, such as mescaline, danazol, oxymethylone and DHEA, and those that are injected, such as trenbolone acetate, testosterone cypionate, and nandrolone decanoate. So, the pros of taking steroids include the fact that steroids are known to increase recovery time. Cortisol is a hormone which is produced inside our body to help it deal with stress. Cortisol is responsible for causing damage to our muscle tissues and also slowing down the time taken for the human body to recuperate. And so steroids are known to regulate the production of this hormone when an individual's body is stressed. Another positive effect that steroids has is that they're known to increase the muscle size of the user. Steroids are also known to greatly reduce body fat within the human body. They have been proved to be a positive accelerator of red blood cell production. Steroids also have been known to greatly enhance athletic performance for the user. This means that the user will experience high energy and high stamina levels after they have used them, and they'll also find the training and ability to push towards new limits during that training a lot easier. Steroids also improve the user's physical strength and his endurance levels. Alright, so now that we've done the pros, let's move on to the cons. So the cons of taking anabolic steroids include potential adverse effects displayed in males, so things such as baldness, prostate changes, the growth of male breasts, and impotence or sterility. Things that can be observed in females include breast shrinkage, increased body or facial hair, menstrual irregularities, premature hair loss, and a deepened voice. Things that can be observed in both males and females from anabolic steroid use include acne, aggression, brittle connective tissue, cardiovascular disease, and cerebrovascular incidents, a dependency on the drug, headaches, hypertension, liver disease, psych and behavioural changes, and a short stature due to the premature growth plate closure. The best documented effects from steroids are on the liver, serum lipids, and reproductive system. Although in saying this, the type of the steroid, the dosage, the frequency of use, the age of initiation to the drug, concurrent drug use, and the individual would have to be taken into account. On top of all this, the use of anabolic steroids as a means of a performance enhancing drug is banned in all major sporting associations, including associations such as the IOC, the MLB, the NBA, the NFL, NHL, ICC, FIFA, UEFA, and many more. Anabolic steroids are deemed as a controlled substance in many countries including Argentina, Australia, Brazil, Canada, the Netherlands, UK, USA, and so not only can you be banned from competing, but in some cases having the possession of steroids can also warrant a jail sentence. Alright, so in the scheme of things, anabolic steroids are a useful strategy in changing the body composition of an individual, although they are still a relatively young class of drug and still require a vast amount of testing and monitoring to further solidify the effects, as well as altering anabolic steroids and looking into reducing the negative effects that can be caused from taking them. But in saying this, they are illegal and they are banned in the majority of sporting contests, so taking them would be a very poor choice, not to mention the various moral sacrifices that you'd be making.